Kentucky has followed the national model based on Building Systems of Care, a primer. And as you can see, the system of care is a concept that holds that all life domains and needs should be considered rather than just addressing mental health treatment needs in isolation. Nationally, this is built around 8 overlapping dimensions. In Kentucky, we've added a few more than that we've recognized are very important for the youth and the families that we serve in Kentucky. Let's look at this picture a little more closely. Physical health. You can't serve and provide services for mental health needs or behavioral health needs without focusing on the physical health. Physical health and behavioral health are so tightly aligned. And where do you get your physical health services? It might be from the health department, primary care physicians, pediatricians, the Commission for Children with Special Health Care Needs, doctors, nutritionists, dietitians, all those types of things that help you pay attention to what your physical body needs. Behavioral health. In this field, that's what many of us are familiar with. The community mental health centers, psychiatrists for medication checks, psychologists, early interventionists, counselors, and substance abuse treatment all fall under the umbrella of behavioral health. Education. This focuses on learning and being able to become self-sufficient adults by having the skills you need to live on your own and to live independently. And this starts when children are young and goes all the way till they're adults, through every stage of the game. Child care. This is one of those areas that Kentucky added into our system of care. A few years back, Kentucky received a Substance Abuse Mental Health Services Administration grant that focused on young children birth to 5 that have social emotional delays and behavioral health challenges. And so we added child care, including daycare centers, in-home child care, relatives providing child care, and babysitting along with the rest of our system of care areas. Recreational services. We know that many of our children that have behavioral health challenges really excel at physical activities and creative activities. And so being a part of recreational services, be that community events, the local theater company, the rec center, formalized baseball and football teams, any of those types of things can be huge for our children and their self-esteem. These are the areas they often excel in. Faith-based. In Kentucky, we know that we have a very strong faith community across the entire state, and so the support that families and youth get from their churches and their synagogues and the spiritual leaders in their community can really make a difference for our children and their families. Department for Community-Based Services. That's what Kentucky calls their child welfare agency. They provide food stamps, supplemental nutrition assistance program. They have protection and permanency that does child investigations, child abuse investigations and neglect investigations. We also have foster care and adoption under that. The court and legal system includes all kinds of things. It includes the administrative office of the courts, which is over our court designated workers. They partner with our judges and train our judges across the state. They work with our family court. And then we also have the Department for Juvenile Justice. And then as our youth become young adults or older teens, they might interface with the adult criminal justice system. So all of those fall under the court and legal system portion of our system of care. Vocational rehabilitation, job education and training for persons with disabilities, helping our young adults to get employed, to become independent, and to have what they need to be independent. In Kentucky, we have the Carl D. Perkins Vocational Training Center. There are only 11 vocational training centers across our country, and one of them happens to be in eastern Kentucky. There are also assistive technology. Assistive technology is available for these young people with disabilities, and also statewide independent living councils are available for them to participate on. And last but certainly not least, in Kentucky we added the Family and Youth Network, which is our KPFC, who provides educational opportunities, networking opportunities, leadership development, and has really worked diligently over the past 15 years to build, strengthen, and enhance Kentucky's family-driven and youth-guided, youth-driven system of care and the movement across the state. We talk about When we talk about the system of care, there are some guiding principles. The system of care wants to ensure that there is availability and access to services, that those services are provided based on individual needs of the child and their families, that evidence-based or evidence-informed practices are used, and we want services that are delivered in the least restrictive environment. If a child does not need to be hospitalized for services, then don't hospitalize them. We want to ensure that families and other caregivers and the youth themselves are full participants and equal participants. We want to ensure that services are integrated at the system level, not a separate plan for child welfare, for juvenile justice, for education. One plan that we can all utilize together, focusing on the goals and dreams of this youth and their family. Deliver services in a coordinated manner. That goes back to those integrated services. Provide developmentally appropriate mental health services and system supports. Regardless of age, where is the child developmentally and where is his or her family developmentally? Facilitate the transition of youth to adulthood, and we've really been working hard on that in Kentucky with our Kentucky Youth Move Council and our Tailored program. We need to incorporate or link mental health promotion, prevention, and early identification. Instead of always just waiting till our kids fall through the net, we need to have something in place to prevent that. We need to have continuous accountability and quality improvement so that we're always looking to improve the services that children and family get. We need to protect the rights of children and families as we promote effective advocacy efforts. That's a big part of what KPFC does. This teaches those teens and young adults and parents how to advocate for themselves and for others in their community. And as always, we need to be able to provide services and supports in a culturally and linguistically sensitive environment, regardless of race, religion, national origin, gender expression, sexual orientation, and all of these other areas that are included in this definition. When we talk about family-driven and youth-guided, which you've heard me mention a few times, that means that families and youth are working at 3 different levels within the systems that serve them. That very first level is at their individual level. They're attending their own family and child treatment teams. They are speaking at those meetings. They are leading those meetings, and their voice is being heard and respected. The second level is at the program level. So those agencies that are providing them services, do they have committees internally within their organization? Do those committees have parent and youth voice who have received services so that they can share what really works and what didn't work? We want to be able to spend our money where it's going to be used most wisely. So we need to have those youth and parents who receive the services help guide those decisions. And then at the third level, that system level, that's, do we have youth and parents participating on boards, helping to make decisions about data that is collected, about how funds are spent, how budgets are made for this agency? When we really want to have a family-driven and youth-guided, youth-driven system of care, we will have family members and youth and young adults who have received services sitting on all levels of the different agencies that serve them. This was a short overview of Kentucky's system of care. In Kentucky, we have the State Interagency Council and Regional Interagency Councils, and a few areas still have local interagency councils. And they are created of many of these players from these different agencies that you've seen in this presentation, working together to try to make sure that families and children do not fall through the cracks in their areas of the state. If you need more information, shoot me an email or give me a call. Thanks. Have a great day.